Good afternoon to everyone. And I would like to use this great opportunity to thank the ICRC for giving the Africa Respiratory Care Association the opportunity to be a chapter. So thank you, ICRC, and a special thanks to the American Association for Respiratory Care for developing this individual and for taking me through the international fellowship program and becoming an international fellow. And here I am, the founder and president of the Africa Respiratory Care Association. I'd like to use this great opportunity to thank all country directors of the Africa Respiratory Care Association, especially to Chad, that is Maha Hamad, Kennedy Gichango for Kenya, Molenga Chanka for Zimbabwe, Jean Claude for South Africa, Trey Garrick for Tanzania, Haptamo Zulilem and Hanan Ali Mohammed for Ethiopia. And I also want to commend the Francophone speaking countries as well. So we have Guinea, Binta Diallo, Yaye Guaye for Senegal, Lais Francais for Burkina Faso, and we also have Gina Agbesolo for Cameroon. Thank you all so much for your support. I cannot do this without the support of the chapters of the Africa Respiratory Care Association. And I want to commend the efforts of the various chapters that are under the Africa Respiratory Care Association. So we have the Liberia Respiratory Care Association, headed by Ebenezer Zofli. Ghana Association for Respiratory Care, headed by Kumi Ampabin Treme and assisted by Josephine Osetutukrang. Lebanon Association for Respiratory Care, Mustafa Kewat over there. Ethiopia Association for Respiratory Care, and today represented by Hanan Ali over here. Respiratory Gate, Egypt. I also want to commend a student organization in Africa, which is the University of Ghana Association for Respiratory Care Students or Respiratory Therapy Students, the Ministry of Health of Ghana, the Allied Health Professions Council of Ghana, the Allied Health Professions Council of Liberia, and all stakeholders that have supported the Africa Respiratory Care Association. I want to say a big thank you to you. So I'm here today to present the ARCA 2025 annual report. I believe that is the report everyone has been waiting for. Okay, so an overview of ARCA. So the name ARCA means Africa Respiratory Care Association. And in Africa, chronic respiratory diseases pose a significant increase, or it's escalating in the healthcare system, and especially in the sub-Saharan African countries. And the Africa Respiratory Care Association is leading the charge in combating these diseases and improving respiratory health across the continent. The Africa Respiratory Care Association is focused on advancing respiratory care across Africa. It plays a crucial role in promoting standardized practices, enhancing education and training for respiratory therapists and respiratory care practitioners, and advocating for better health policies and infrastructure. Our mission is to reduce the burden of diseases in Africa by strengthening the respiratory care workforce, providing opportunities for professional growth, and promoting innovative solutions in respiratory care. Our initiative this year has been enormous, but this is the basic initiative that we have to achieve. So we advocate for respiratory care programs in universities in Africa, capacity building and professional development, especially through our ARCA webinar series, research collaborations and public health awareness, partnership with local and global respiratory bodies like the International Council for Respiratory Care, Canadian Society for Respiratory Care, American Association for Respiratory Care, and etc. Okay, so a summary. So the year 2025 presented a historic period of growth, structural development, and continental impact for the Africa Respiratory Care Association. And across Africa, the Caribbean, Middle East, and other member countries, we have advanced in advocacy, workforce development, education, and national policy engagement. We have so far 22 participating member countries with membership of 1,500 across the globe. And ARCA strengthened its role as the leading professional voice for respiratory care on the continent of Africa this year. Now, this consolidated report that I'm about to present will synthesize contributions from the various country directors and national associations, student groups, and strategic leaders or leadership that provided an integrated overview for the accomplishments that we have had. And I will also identify some challenges and our way forward for 2026. So, status of respiratory care in Africa. So in this report, I would mention a report from Ghana, Nigeria, Cameroon, Angola, Somalia, and touch on Ethiopia and Guinea. So for Ghana, this year, we have had rising air pollution levels, and this has caused a lot of respiratory care problems across the nation, and thereby affecting national health and infrastructure. Now, the clinical reality is the burden that it creates, which means this year alone, we recorded high incidence of acute respiratory infections among children, and the seasonal flu and viruses, which was detected, which means a new strain was detected, the influenza A, and the human metapneumovirus was also detected through a quality surveillance that was organized in Ghana. So I must commend the Ministry of Health for this great initiative that you're doing. And this means that this gives respiratory therapists the opportunity to be noticed, and for the government of Ghana to recognize our role in patient healthcare. We also recorded increasing prevalence of chronic obstructive pulmonary diseases. And what are the strategic alliances and collaborative efforts that we did with Ghana? So the Africa Respiratory Care Association, in collaboration with the Ghana Association for Respiratory Care and the University of Ghana Association for Respiratory Therapy Students, and national critical care organizations such as the Ghana Thoracic Society, Critical Care Nurses Society of Ghana, and the Pediatric Nurses Association were involved in awareness creation through awareness campaign, public education, radio and television campaigns, social media campaigns, and public outreach, driving community prevention. So that is something that we did through the African Respiratory Care Association. And then we also encourage professional development. So through the Africa Respiratory Care Association webinar series, we were able to bring all these professionals that manage respiratory health or that manage the pulmonary health together to also have more education and insight and overview of what they are actually dealing. So the Africa Respiratory Care webinar series played a major role in bringing professionals together and thereby helping mitigate that burden of the respiratory problems. I also use that opportunity to engage the Diasporan Office of the Republic of Ghana, and I got the opportunity to interact with the Deputy Diasporan Affairs Office of the President of the Republic of Ghana, because I am not on ground in person. I'm here in the United States, so I needed to reach out to that office for them to support us and become a voice to the Ministry of Health on our behalf. So I engage with them for so many things, and that is where I was able to talk to them about the profession, that the respiratory therapy profession, and hence the association, Ghana Association for Respiratory Care. So what I'm trying to establish here is that the African Respiratory Care Association this year became the main voice behind the Ghana Association for Respiratory Care to the Ministry of Health. We were able to champion their voice across to the Allied Health Professions Council and all stakeholders in the country for them to recognize the profession and thereby positioning us as part of the healthcare policy making and system development. So what is the way forward for Ghana? The way forward is that respiratory care and the profession transition from a support function to a central pillar of Ghana's national policy. So that is what I'm doing as governor for Ghana. And I'm also ensuring that in 2026, we have continuous engagement with the Ministry of Health and the Allied Health Professions Council, Ghana Health Service, and all governmental bodies to support the profession by encouraging massive employment and good salary structure for our professionals. I would also ensure that in 2026, we have continuous professional development programs, thereby strengthening the workforce in Ghana. So during the Respiratory Care Week, we did a lot of programs, and I must commend the leadership of the Ghana Association for Respiratory Care and the efforts by Josephine. She did tremendously great during the Respiratory Care Week. You can see in our pictures here, we have activities that was done in various hospitals where respiratory therapists work at. So in Kolebu Teaching Hospital, we had a respiratory care week lunch where we brought all the clinical heads of department where respiratory therapists work at to come and then listen to our presentations and thereby giving their support to us. We also had programs at the University of Ghana Medical Center where respiratory therapists and other faculties and department heads met to have a lunch as well. We also used that week to do a lot of simulation practice where we introduce our students, which means the respiratory therapy students that are in school practicing or learning. We had to engage them in clinical simulation. That way we are ensuring that we keep the clinical practice intact. I also use that opportunity to participate in the week celebration for Ghana virtually, where I also gave a talk and I did some presentations as well. So I want to use this opportunity to commend and thank our faculties at the University of Ghana Department of Respiratory Therapy under the leadership of Dr. Esther Brobe for her support. And I also want to thank the former provost of the College of Health Science, that is Professor Ayikumi, and Dr. Audrey Forsen, who was formerly the governor for Ghana at the International Council. I want to commend them for their effort and their support. In fact, these individuals that I've mentioned have been a support to us even at the Africa Respiratory Care Association, and they are continuously supporting by advising and guiding me to strengthen other African countries as well. So it's not only in Ghana. So Ghana is actually becoming the pivot of Africa and supporting the rest of the countries in Africa. Now we have another beautiful story in Nigeria, which is championed by Dr. Olubenga Agbelemoshe, who is right here. He is the country director for Nigeria and also the director for programs and policy. So Dr. Olubenga this year did a lot of initiatives in Nigeria, and I would like to give that report. So Nigeria faces a significant burden of respiratory disease exacerbation by factors such as environmental pollution, high smoking prevalence, and limited healthcare infrastructure. In response to this, Dr. Olubenga, country director for Nigeria, initiated a groundbreaking program to establish the structured and sustainable respiratory therapy education and service provision model. Now, this report will outline some few things that was done in Nigeria this year. The objectives or the aims of establishing this program in Nigeria was to, one, establish a formal respiratory program within the Nigeria model schools and health institutions. Also to provide respiratory care services in both urban and rural health facilities across Nigeria by establishing initial programs in Lagos State. Lagos, because Lagos is the largest city in Nigeria. It also aimed to reduce the respiratory disease mortality rate through early diagnosis and effective treatment. He also aimed at raising awareness about respiratory health, preventive measures, and environmental impact on lung health, and advocate for policy development to integrate respiratory therapy services into Nigeria's healthcare systems nationwide. These are some few implementations that he was able to do this year with the support of the Africa Respiratory Care Association. He ensured that universities in Nigeria, especially University of Lagos, got to know more about the profession. You know, introducing a profession into a country comes with a lot of challenges, but he went all out to meet all the stakeholders that he could meet so that he can introduce this program to them. He has also been involved in curriculum development, capacity building workshops, creating awareness both on social media, both on radio, television, and then engaging with key policymakers, especially the state governors and even the Ministry of Health as well. There were some challenges encountered with the Nigeria impact. And these challenges were difficulty connecting with the Ministry of Health for policy engagement. So there were those challenges. And then limited funding and healthcare resources to support this particular movement. And then in Nigeria, there is no respiratory therapy program over there. And so there is a strong need to establish the profession and have that recognition over there. And then low public awareness of respiratory diseases. So Nigeria is really in the center of these issues. Now, but there has been some achievements amidst all the challenges that he encountered. He was able to put together a temporal association that the Nigerian government would be able to recognize and relate to. And that is what we call the Association for Respiratory Care Therapists for Nigeria. Obviously, in the course of the years, after it has fully been established, we are looking forward to changing the name to Nigeria Association for Respiratory Care. That way, the government would really see the involvement or the evolvement that the profession has become. He has also achieved growing awareness among medical students and healthcare facilities. What he did was to encourage the program by creating workshops, seminars, and all that in person to the people of Nigeria. And then as well, there were some presentations at the National Hospital of Abuja and then the Federal Medical Center with strong medical leadership support. So at least there are some hospitals that are showing some support over there to help start the program. We were also fortunate to have media attention in Nigeria. So through the Nigerian Diasporan Affairs, the Diasporan Office in Nigeria was able to rally behind him to also champion his voice across to the government. And in terms of advocacy, I want to use this great opportunity to commend Dr. Olubenga for what he did in Nigeria, and in collaboration with Sir Joe, who is also a member of the Africa Respiratory Care Association, and then the president of the Africa America Chamber of Commerce. He used his position to support him in Nigeria to get some stakeholders who can rally behind him to get this initiative done. I would want to share this short clip for you to see what is actually on ground in Nigeria.
Yeah, in the healthcare ecosystem that seems to be undermined, little wonder as we speak, and this is a crying shame in the whole of Nigeria. It was a bit conservative when he said that we're too few. I mean, there are too few professionals in that area. And the alarming reality also is that in the whole of Akwa Ibom, we don't have a single, purpose trend respiratory therapists. And that's why he's here to create awareness. And if there is any part of our body that is very sensitive and has got to be intentionally taken care of, they are the lungs, they are the heart. I mean, it is the heart and they are the lungs. But oftentimes we tend to get into practices and lifestyles that are inimical to the well-being and health of these very critical organs. So I'd like to thank you again, Dr. Agbele Moshe, for your time. Okay, so the way forward, you talked about what we need to do as individuals, the things we need to avoid, but I'd like you to say them again, let them reverberate. How do we take care of our lungs? How do we take care of our hearts as individuals? Let that responsibility start from us. So let those pieces of advice resonate yet again.
Well, thank you again. I think that one is the knowledge and awareness. What you put into your body affects your body the way, in ways that may be detrimental to the individual. But at the same time, having the knowledge of what you put into your body, there are going to be some people that the damage is already done. But how can we continue to make sure that these people live a fulfilling life, a life sustained, that they could still continue to do all the things that they need to do? Having a profession where, you actually have expert clinicians that could help with education, that could help with when patients come to our hospitals to get care, to make sure that we have trained people that are experts to be able to care for this patients. So I think those are some of the practical things. Now, also, we also need to be aware of the trend of the smoking. Smoking is bad for you. For those that currently smoke, whatever you smoke, because there are different forms, from from the cigarettes to the vaping, to
marijuana,
to marijuana, to
come in all forms and shapes.
All forms, but anything, they have a damaging effect on the lungs, and at least before someone quits, people may not be able to quit right away, to look for other forms that could help them quit, or to minimize, to gradually decrease the total number that they actually do. That way they can eventually stop. That way they can, in the course of time, because not.
Okay, so that is a story from Nigeria. So the future goals for RT in Nigeria is to establish accredited RT degree, that's respiratory therapy bachelor's degree, nationwide by 2030, and then to secure national RT policy and regulatory recognition, and to expand clinical sites and long-term public awareness campaigns, and to strengthen partnership with hospitals and universities for training and capacity building. So a story in Cameroon. So over here we have Madam Gina Agbesolo. So Gina Agbesolo is the lady sitting over there. She is the country director for Cameroon at the Africa Respiratory Care Association. And she is supported by Mr. Chamo Cedric and Mr. Larry Anwar. Now, Chamo is the director for advocacy and relation representative for Cameroon, ARCA. And then Larry is the secretary. And these three-member team have really worked tremendously this year. This year, they have successfully been able to identify a university in Cameroon, which is the University of Chan. Now, this came about as a result of a meeting we were able to have with Dr. Lisa Trujillo and Dr. Karen Shell, who inspired us to identify a university and then sell the idea to them. That way they can embrace the profession and understand who we are as respiratory therapists and see the need for respiratory therapy program in their country. So I want to use this great opportunity to thank Dr. Lisa Trujillo and Dr. Karen Shell for their immense support of the Africa Respiratory Care Association and also the Cameroon chapter of the Africa Respiratory Care Association. Please let's give a clap. Let's give her a clap. Dr. Karen, thank you so much. Now, she encouraged regular meetings. So what we did was that we had regular monthly meetings, engaging them back to back. And finally, we were able to get the attention of the University of Chan. So I also want to use this great opportunity to thank the University of Chan for embracing our quest for establishing the respiratory therapy bachelor's degree in that university. And I want to use this opportunity to say that by the year or by fall next year, 2026, we are hopeful that we should be able to kickstart the bachelor's degree program in Cameroon. Angola. So Angola this year has done tremendously well in promoting and creating awareness for respiratory therapy and respiratory health. This year alone, Madam Katia Esiolo Otet, who is the country director for Angola in ARCA, organized a conference. And this conference brought all health stakeholders, health professionals, doctors, all healthcare personnel to that conference. And that was the opportunity she had to showcase the Africa Respiratory Care's mission to them. And even though it was in Portuguese, but language wasn't a barrier, we were able to get translators that could translate the English language to Portuguese for them. I got the opportunity to present at that Congress on a virtual side. And I would like to use this great opportunity to just share that short clip to you.
E também a Associação Africana de Cuidados Respiratórios, que também é chamada de ARCA, que é uma abreviação.
Our vision is to ensure every African individual has access to high quality respiratory care.
Estamos aqui para assegurar que todos os africanos tenham acesso a cuidados de saúde.
And respiratory therapists are recognized as essential health professionals.
E essa associação também é
That was my
reconhecida.
voice over there, so I had to join on a virtual side to present at the Angola Congress. Okay, so in Somalia this year, we were able to also have some workshop programs where we use that opportunity to showcase the role of respiratory therapy in respiratory health management. And I want to use this great opportunity to commend Yonis Abdul Kadir, who is the country director for Somalia in ARCA, and Dr. Ikran Abdul, the lady in the far corner over there in the black hijab, for her tremendous support. So Dr. Ikran, I want to say thank you. Thank you so much. We really appreciate your efforts greatly. This lady and Dr. Yuanes have really worked hard to ensure that their government stakeholders are able to embrace the profession. And as I'm speaking to you, we have been able to identify university in Somalia, that is University of Bosaso. So University of Bosaso, hopefully next year would start something in the bachelor's degree program in Somalia. We also had various projects in Help Baby Breathe and Saving Little Breaths. And that particular project actually showcased the role of respiratory health in mother and child delivery and also in adult care. So the Help Baby Breathe brought a lot of professionals, a lot of government officials, especially directors of health, Ministry of Health in Somalia. And I want to use this great opportunity to say thank you to the Ministry of Health of Somalia and other health directors that participated in this program. So these are pictures that showed our collaborations that we have done with the Global Health Alliance that is headed by Dr. Ikran Abdul. And you can see the programs that were held this year where we had a lot of Somalian ladies and men as well. I mean, coming and then participating in the Help Baby Breathe project and as well as the seminars that we had in Somalia. Okay, so we have another wonderful story from Ethiopia, and I want to use this great opportunity to acknowledge the president of the Ethiopia Respiratory Care Association, that is Hanan Ali, and then the country director for Ethiopia in ARCA. He is in the person of Haptamu Zulilam. Thank you. This year, Haptamu and Hanan have done tremendously great deal of work, and the Africa Respiratory Care Association wants to commend them for what they have done. I'd like to enlist some few achievements that they have been able to do, and then mention some challenges and then the way forward for them. Okay, so some major achievements from the Ethiopia side is they have been able to have organizational development and governance. Now, how have they been able to do that? By establishing the Ethiopian Association for Respiratory Care and having the government of Ethiopia recognizing their local association, and also for them to be as a chapter of the Africa Respiratory Care Association. They have also enhanced educational advancement and academic pathway development, which I commend them for. And I also want to commend them for foundational work for the BSRC program establishment. Now, we are hopeful that in 2026 September or around fall season, we should be able to officially kickstart the bachelor's degree program in Ethiopia. And that I want to commend both of them and the Ethiopian Association for Respiratory Care for their immense support. They would not have been able to achieve this without the help of the Ministry of Health of Ethiopia and the Health Services of Ethiopia. And with this, Africa Respiratory Care Association wants to commend them greatly for that. So thank you, dear stakeholders and government officials. And then I would also want to say they have been involved in drafting national roadmap and career pathway for health professionals, especially in respiratory therapy. And they have also been a pivot in continuous professional development through the Africa Respiratory Care Association. Now, this offers critical care practitioners in Ethiopia the opportunity to have more hands-on session and online virtual sessions with seasoned respiratory therapists and clinical expertise in respiratory healthcare. They have also ensured clinical advancement and research, and currently they are embarking on a, a major research which has to do with landmark pediatric spirometry research, forged a strategic collaboration with Addis Ababa University to conduct a pediatric spirometry coefficient study, and as part of the initiative for the Ethiopia Association for Respiratory Care. And the members are actually working hard towards this. They've also established country level advancement in sleep medicine. What they have done is that they initiated efforts to advance the field of sleep medicine within Ethiopia, laying groundwork for future diagnostics and therapeutic services for sleep disorders and breathing. And this, I would like to commend them for that. Now, and they have also achieved technical working groups members, and this they have participated in national tuberculosis management guideline technical work group in collaboration with the Ethiopia Thoracic Society, ensuring that the role and expertise of respiratory therapists are integrated in national policy. So that is a great achievement from the Ethiopian side. They have also embarked on advocacy, public awareness, and knowledge sharing. And with this, what they have done is that they invited by the Africa Respiratory Care Association and the Ethiopia Association for Respiratory Care Leadership, we presented Journey of Respiratory Care Profession in Ethiopia during a flagship ARCA Week celebration. So that very week, we showcased how the journey of respiratory therapists in Africa has been like and the way forward. So this brought the limelight of the profession to all stakeholders and health professionals. Now, this presentation serves as a learning model for merging national associations across Africa. And then the Respiratory Care Week, they also had a special week celebration. They collaborated also with the local hospitals and ARCA, obviously, and then international respiratory organizations to have continuous professional development in their own level and also celebrate it in their home country by having seminars and workshops during that week. And this is a picture to show what they did and a group of respiratory therapists and health professionals that gathered during that week celebration. And I also want to say a big thank you to the Ethiopia Association for Respiratory Care for their support. Over here, you can see Hanan doing some presentation and some executives of the Ethiopia Association for Respiratory Care. And I want to use this great opportunity to commend them for their immense support towards the leadership of the Ethiopia Association for Respiratory Care. They also did some advocacy for World Asthma Day, and which brought all health professionals, students, and health workers across the country to participate and get the awareness and knowledge about how asthma should be managed. And that was a great impact in asthma management and the week celebration as well. They also had international collaborations and networking. So they facilitated the selection of qualified Ethiopian respiratory therapists for international fellowship program, fostering individual career growth and bringing international expertise back to Ethiopia. Now, with this, I want to commend Hanan Ali for her immense support because she has been the first international fellow of the Ethiopia um, Association for Respiratory Care, opening the gate for all Ethiopians to also qualify to apply for the fellowship and thereby getting this exposure that she has gotten. Now, the exposure that she has gotten today, she is not going to keep it to herself, but I promise you that she is going to impact her country immensely and she is going to support the Africa Respiratory Care Association and to enhance it in other countries. So we commend her for her achievement. Now, some of the challenges that they have encountered has been resource limit, like financial limitations. And as you know, we need money to do so many things. So in initiatives that they have embarked on, money will definitely come in as a great resource to help. And then they have low workforce density. Now, the number of qualified respiratory therapists relative to population need is still low. So there is the need for more respiratory therapists to be enrolled and to be educated as well. And then policy integration. There is an ongoing effort to integrate the policies into of respiratory profession into the government policy. So that is a very great health strategy that the EARC is doing. And then they have also encountered low recognition of the profession. But the Ethiopia Association for Respiratory Care is doing their best through their Ministry of Health and other health services to promote and be the voice of the profession in their country. And the Africa Respiratory Care Association will be behind them to make sure that their voices are heard in their country. So, what is the future direction for the Ethiopia Association for Respiratory Care? Now, the EARC seeks to advocate for the BSRC program, which I said could start next year. They also look forward to strengthening local international collaborations, expand CPD offerings for more participation, and then also strengthen government partnership, as well as having membership drive. This would go a long way to strengthen the profession and promote the recognition of the Ethiopia Association for Respiratory Care's efforts. And in conclusion, I must say the past year has been one of the unprecedented progress for respiratory care in Ethiopia. The EARC has moved from a vision to a vibrant, action-oriented professional society focused on both immediate impact and sustainable long-term growth. Their achievement from foundational work on the BSRC program to sharing their story to the continent is a testament to the dedication of the members of the EARC. And at this point, I want to say a big thank you to the members of the Ethiopia Association for Respiratory Care, as well as the entire executives, for your immense support towards the leadership of the Ethiopia Association for Respiratory Care. We are proud to contribute to your success, and we are proud that you are also a pillar of Africa's progress. So we really appreciate you greatly. And on that note, I want to use that great opportunity to say a big thank you to Haptamu Zelenam and Hanan Ali Mohammed for their great effort and exemplary leadership in Ethiopia. Thank you very much. The country director for Chad, in the person of Maha Ahmad, also organized a presentation at Master University for Science and Technology on their Respiratory Care Week. And the program was the Second Scientific Day Respiratory Care Technology Program, of which she showcased the Africa Respiratory Care Association to the university and to the students as well as faculty. And I would like to share some brief information about that. Okay, so the scientific day was organized by the Respiratory Care Technology Program to promote scientific engagement, clinical knowledge exchange, and professional development among students and faculties. The event brought together academic leaders and clinical experts, researchers, students to discover various aspects of respiratory care. Now, it was attended by great personalities in the school, in the person of Dr. Hanan Gewafal, who is the Dean of Faculty of Applied Science and Technology, Professor Dr. Salma Mokima, Vice Dean for Postgraduate Studies and Scientific Research, Dr. Wafa Ashur, Head of Respiratory Care Technology Program, and then Dr. Nivarana El Kashanki, El Shalankani, Professor of Anesthesia and ICU RCT Program. I want to say a big thank you for your participation and your support in this program. And the Africa Respiratory Care Association would like to do more connections with these individuals. Other key participants included Professor Dr. Yusuf Ahmed from the Faculty of Medicine of the university and industry representative from the EZZ Medical Company and Biomedical Technology. Attendance, this conference or workshop or respiratory care program that was organized in Egypt was attended by 100 to 150 participants, which included faculty, students, leadership institutions, and clinical instructors. And the summary is that the lecture that she gave on the Africa Respiratory Care Association got students incited. They were inspired to do more. So we had more students participating or joining the Africa Respiratory Care Association. And in Pakistan, I would like to use this great opportunity to acknowledge the efforts that Asalan Zafar is doing, and as well as Mr. Shukat, who is the governor for Pakistan in the ICRC. Now, Asalan is the country director for Pakistan at the Africa Respiratory Care Association. Now, in 2025, he did a lot of engagement, and 2025 indicated significant steps that were taken to advance the presence, identity, and advocacy of respiratory therapy across Pakistan. Engagement with respiratory therapists nationwide and collaboration with governor for the ICRC for Pakistan strengthened the recognition efforts and supported the development of more structured local respiratory care association. Now, he did a lot of initiatives this year, but I would like to mention the key ones that was done. He delivered some talk on ventilatory strategies in obstructive and restrictive lung disorders at the Shifa International Hospital during the Respiratory Care Week. This got a lot of attention and participants, and he also coordinated RT participation to address practicing licensing concern. Now, Pakistan has been involved in the Africa Respiratory Care because they are also international member country to the Africa Respiratory Care Association. And their plans for 2026 is to resolve title issues with their Allied Health Professions Council for them to really have a good recognition about what the scope of practice for a respiratory therapist in Pakistan is all about. They also want to expand the reach of ARCA in Pakistan. So I want to use this great opportunity to acknowledge and thank Asalan and also thank Shukat for their excellent and supportive initiative that they are doing in Pakistan. Collaborations. So this year, the Africa Respiratory Care Association has collaborated with the following organization, the Breathe Well Initiative. And the Breathe Well Initiative is championing respiratory health in Sierra Leone. And then the Global Health Alliance, also championing respiratory health in Somalia. And then we have the Global Asthma COPD Outreach, which is actually bringing and bridging the gap of asthma and COPD management. Evergreen Royal Academy, a primary junior high school where caregivers and faculties and students are always trained on asthma management. So we have started community engagement where we go to schools and then educate the caregivers or the teachers on basic management of respiratory problems, especially like asthma management. ARCA has been visible this year on online, and we have created a lot of impact on social media this year. And I would like to use this great opportunity to commend the Director for IT, that is Mr. Stephen Darius Bender. He's the gentleman sitting by Dan Rowley on the right with a black cap. Kindly give him a round of applause. So all the media stuff that you see, all the visuals that you see that we post on our social media handles, he is the person in charge of that. And he has done a great job this year to make ARCA visible on social media. So we currently have 17 country directors representing 17 countries. And with a total of 1,239 active members of the Africa Respiratory Care Association. And special initiatives. So the ARCA webinar series this year, we organized 17 webinar sessions. The webinar series with about 2,893 people registering. And then we had 7 webinar sessions for the Respiratory Care Month alone. And these 7 webinar sessions were cut across Arabic language sessions, Portuguese language sessions, English, and then French language sessions, because Africa, being a 54 country in a continent, is not just an English speaking continent. Africa has more diverse languages like Portuguese, Arabic language, and French. So we were able to at least touch the heart of the people through the language sessions in our webinars. So you can see over here some of our webinars that we did, and then that got the attention for the roles of respiratory therapy. And I want to use this great opportunity to thank all the speakers of the webinar sessions. And I want to say thank you, especially to Dr. Azu Ari, who is here, who presented as well. Say thank you, Mustafa Kaiwa. Thank you so much for your effort. And Dr. Olubenga, you also officiated the webinar sessions, and I want to say thank you. This year, Moaz Esam also presented in our webinar sessions on mechanical ventilation, and I want to say a big thank you, Moaz, for your thoughtful education. So Dr. Walima Bakos also presented this year on tobacco and then the effect of it on your lungs. So I want to say a big thank you to Dr. Walima Bakos for your help, and all those that did the translations for us. Thank you so much. And a brief message for all of us. So this is a take-home message that I want to share with you, and that came from the ambassador for Guyana in the Switzerland. and he is Dr. Ramsamy. Dr. Ramsamy is a representative of the United Nations, and he has a message for all of us.
Thank you for an excellent and an insightful presentation. Thank you, Dr. Fofana. We are so grateful. And before I read the Q&A, I would like to give the opportunity for the ambassador for Guyana to Switzerland, and then a representative from the UN in the person of Dr. Leslie Ramsamy to say a word or two.
And thank you very much, Dorothy. Thank you, colleagues from various African countries. I know my colleagues in Guyana are also listening. Let me thank a few people first of all. Dorothy and the African Respiratory Care Association. Congratulations, Dorothy, and congratulations to ARCA. Let me thank and congratulate Dr. Dama Opana for a very insightful presentation this evening. I am not certain if our colleague, the Minister, the Honorable Minister of Health from Ghana, is on this afternoon, this evening. But if he is, then I want to say hello. I met the minister here in May, and he expressed his interest in promoting lung health and respiratory health in Ghana and support the movement to improve respiratory health and lung health across Africa. The importance of lung health and respiratory health have been underlined by Dr. Fofana. And I will say something about that. It is for me unfathomable that a condition that in terms of chronic respiratory diseases, there are 455 million people living with those conditions. And each year, 4 million people die from chronic respiratory diseases. But in fact, at any one moment right now, about 700 million people live with respiratory illnesses or conditions that affect their health. We sometimes forget that in addition to chronic conditions that affect more than 450 million people, about 500 million people on an annual basis suffer from infectious diseases where their respiratory conditions deteriorate. And yet, our investment in respiratory health has not matched the disease burden. And it's not just that our investment in respiratory health does not reciprocally reflect the disease burden. In terms of our human resource for health, we don't pay enough attention for those professionals that we need to ensure proper diagnosis and proper treatment. We also have not appreciated the fact that respiratory professionals, whether it's doctors, nurses, or respiratory therapists, are required not only for the direct respiratory illnesses, but there are other conditions in which respiratory function deteriorates and contribute to more serious illnesses, cardiovascular diseases, for example. So it is an undervalued and underestimated health issue. I will say this, that we cannot achieve universal health coverage, and we cannot achieve the targets of the SDG 3 if we do not change the imperative and if we do not change the dispensation. We need more investment, we need more attention to respiratory health in developing countries.
Thank you.
Thank you for an excellent and
So thank you. And I want to use this great opportunity to also thank Dr. Sue Osen and Emory University for their support this year. They have really been impactful with our webinar sessions and also promoting innovative solutions in healthcare. So on that note, the Africa Respiratory Care Association says a big thank you to you all for your support, and we encourage collaborations across various chapters. Thank you.
We have a question for Ricky on college. Yeah, hello everyone. My name is Khalid. I'm from Saudi Arabia, and I work with Dan as assistant president. So I have a quick question. I like the idea of podcast since the beginning, but why we have Lebanon, Guyana, and Pakistan lots of podcasts in North Africa?
Thank you very much. So in developing a program, you need collaboration. So in having international members like Lebanon, where they have the Lebanon Association for Respiratory Care, and then we have Pakistan, we have Guyana, and we have Jamaica. These countries have not just come in as member countries, but they have also come in as collaborators to also share that vision with us and to support, whilst we also support them to also grow. So that is why we also encourage international membership. And as we are speaking today, Haiti has also joined the Africa Respiratory Care as an international country member. Thank you. You're welcome.
Any other comments? Nice. Dr. Harris.
Let's see. Yep. Perfect. Fantastic job putting in the presentation and again, all of this work and also how quickly you brought all this together. This is less a question and more of just a comment. But one of the things that I think ARCA can really help with, there's still such a disparity of resources across the continent. You have a place like Liberia that the highest level of critical care is relatively low compared to a place like Ghana or Nigeria, where you have some hospitals that have world-class resources and others. All to say, I think it would be interesting to see ARCA bring opportunities to people in countries like Liberia on the continent of Africa, where they can more readily go to a place like Accra, go to a place like Lagos, and learn about ECMO and learn about addressing chemical migration. And that's not just Liberia, there's 40 other countries. But I think that's the future, and hopefully curious to get your thoughts on that.
Thank you very much. And that is what we call the exchange program. So exchange program is not going to be just students coming to America, but Africa for Africa as well. Thank you very much.
Very nice report again, Dorothy. I want to commend the Africa Association and your members have certainly demonstrated a tremendous amount of work over the past year in particular. And I thank you all for your efforts. And part of the formation of the Africa chapter of the ICRC has demonstrated fairness to unite countries within continents, which increases ability for knowledge sharing, but also development. So thank you for helping lead that mission. And I think that the intent of the chapters is well represented here in the report.
Thank you very much.
Okay,